Hi, Ginger.
Hi, nice to meet you.
Nice to meet you too. My name is Dr. Matt. I'm going to do your exam today.
Okay.
Can you please verify your last name and your date of birth?
Last name is Smith, Smith, and date of birth is 10/31/1991.
Okay. And what brings you in today? What's going on?
I've been having like some muffled sounds in my ears, so it's been a little hard to hear a little bit.
Is it in both ears?
A little bit, yeah.
Are you experiencing any pain?
Just slight pain a little bit.
How would you rate your pain on a scale of 0 to 10?
I would say maybe a 3 or a 4.
Are you taking any medicine?
No, not right now.
Do you have a history of infections? Frequent ear infection?
No history of it.
Have you noticed any other types of sounds, like any ringing in your ears?
Just a little bit hard to hear, I would say, so
Okay.
yeah.
And when did this start?
About a week ago, I would say.
Okay. Any injuries in the last years?
No injuries.
And have you noticed anything abnormal with your vision?
I would say sometimes it's just a little blurry in like the sun, kind of.
Okay. And when did this start?
Maybe just like a month or 2 ago, I would say.
Okay. Any changes in your smell or taste?
Not that I've noticed.
Okay. Are you feeling any kind of sensitivity on your arms or on your chest and belly?
Maybe like a little bit on my arms and chest, I would say.
Does it go towards the back?
A little bit, yeah.
Okay. I'm going to just put gloves on. And I'll start with vital signs.
Okay.
Okay, so we'll take your blood pressure. I'm going to have you relax. This is going to feel a little bit cold.
Okay.
Blood pressure is good. 110/70.
Okay.
So that's normal. Right, first I'm going to check your olfactory nerve, and that's your sense of smell.
Okay.
But before I do that, I just want to make sure that there is no obstruction. So go ahead and look up for me, please. Just going to look inside a nasal canal here. I'm not seeing any inflamed adenoids, so that's good. I have here, it's called Centaur, and there are a few smells that they're very easy to detect.
Okay.
I'm going to go ahead and cover one nostril. Can you please breathe in, breathe out? Okay, no obstruction there. Okay. Go ahead and try to associate this smell with something.
So like pepper.
Okay, yeah, that's good. All right, so there's no right or wrong answer, just whatever your brain associates the smell with.
Smells like roses.
Okay.
Smells like lemony Febreze.
Okay. Now I'm going to take a look inside your ear. I'm going to have you look towards your right side. I'm going to have you relax. Okay. There's a little bit of redness, but it's kind of hard to visualize. There's a lot of earwax on the left side.
Okay.
Exactly the same thing on this side. What we can do today is to do an ear cleaning. I'm going to have you lay down and we'll take a look and see what kind of treatment we can do.
Okay, yeah, that sounds good.
I'm going to check your hearing first. Can you please tell me which position here is louder? Position 1, which is this one, or position 2?
Position 1.
Okay. Same thing on the other side. Position 1 and 2.
Position 1.
Okay. Go ahead and tell me when you don't hear this sound anymore.
I don't hear it anymore.
And what about now?
I don't hear it anymore.
Okay. I'm going to touch you with two textures. And one is going to feel dull, the other one is going to be sharp. This is what dull is going to feel like. And this is what the sharp is going to feel like. Go ahead and tell me if you feel sharp or dull.
Dull. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp.
I'm going to go ahead and palpate both ears in the same time. I'm looking for any tenderness or anything swollen on the outside. Any pain here? So I'm palpating on the masted bone.
No, no pain.
Okay, that's good. I'm not seeing any redness either, so that's a good sign. we can definitely take out of the way any signs of mastocytitis. All right. So first I'm applying a necktie bacterial spray. This will go on the outside, on the tragus. It's gonna feel a little bit cold. Okay, this is going to feel a little bit wet. Go ahead and turn your head a little bit towards the right. I'm going to apply an unscented gel. It is antibacterial and it's going to help to really catch some of that earwax. just a gentle cleanup here to remove some of the earwax that's stuck on the ear canal. I'm going to apply a little bit of magnesium oil. It helps to decrease inflammation and to relax the muscles so that we can go ahead and do a little bit of cupping. It helps to drain some of that fluid that was stuck under and behind the ear on the medial side. And apply acupressure on the mastoid bone, going down and just trying to activate the lymphatic drainage. Gently applying pressure on the trigger points. This is going to feel a little bit cold, just applying some pressure here. This helps to stimulate blood flow. I'm going to go ahead and apply ear seeds. Just going to try to find those points that correspond to the main organs so that we can activate them. The first organ that we're going to try to stimulate is the spleen. And the spleen is found kind of like on the lower side of the earlobe. This acupressure ear seed applies continuous pressure on that trigger point. Also, we're going to stimulate blood flow to the liver. It's going to help to detoxify the body. And lastly, I would like to activate the adrenal glands. It's going to help to lower stress hormones. And it's going to help the body balance. Just going to gently apply continuous pressure here until it sticks.